Yeah, check 1 2, check 1 2. Is this mic on? Is this mic on? Hey, listen, man. It's the one and only trendsetter DJ Sense, and you're listening to CockTales. Dirty discussions with Kiki and Medinah Monroe. Yeah.
Today's cocktail is called Let That Man Go.
Please.
The ingredients you need for a Let That Man Go. You need 2 ounces of tequila, 1 ounce of triple sec, 1 ounce of passion fruit juice, a ½ ounce of mango puree, and a ½ ounce of lime juice or 1 fresh lime. So to make a Let That Man Go, you're going to add the tequila, the triple sec, the passion fruit juice, the mango puree, and the lime juice into a cocktail shaker filled with ice. Shake for about 5 to 10 seconds. Pour from the shaker into a glass filled with ice and enjoy that amazing cocktail. I've already tasted it.
I have not. I hope it's not thick like me because that mango puree, let's see.
I can't even feel the mango puree. It just tastes mango-y. I love it.
Okay, Jessica, you did it. It's good.
You guys.
It's good. It's not too thick. I can't stand a thick-ass drink.
You know.
You said it's a texture for me.
Yeah, like
If you
I
guys
only
are
like one
interested
thing that
in
way.
learning about how to make new cocktails, you want to book Jessica, go to @YourTipsyHomegirl on Instagram and on TikTok. She makes delightful cocktails. You can book her for a party, baby shower. If you just know a man that is rich and you want somebody there making drinks, she could come. She could teach a class, birthday parties. Have her pull up. She's been pulling up for us, and I am just in love with these drinks.
Or maybe you just don't want to drink alone. So you hire Jessica to come over.
Jessica there making drinks and sitting there with you like, okay, ma'am, I got to go.
Company, okay?
Yeah, I wanted to watch the Super Bowl at home. Anyway, welcome back to Cocktails Dirty Discussions, you guys.
Hey, y'all.
This week, we have a very special guest. We have Dr. Whitney with us today.
Hey, y'all, what's going
Hey.
on? I'm excited a little bit.
We've been having lots of professionals on. She is an OBGYN.
And this is the very first OBGYN we've had on. And Kiki and I wanted to make sure that we had a Black woman OBGYN on because we are Black women.
Okay.
And we be needing to talk to Black women.
Hello. Let's talk then. Come
Hello,
on, then.
Whitney.
Come on.
So how long have you been an OBGYN?
So I have been out of residency, completed my formal training for 2 years now.
Okay.
And I've been at my current practice for about 2 years. It's been awesome. I'm having a time of my life.
Did you always know you wanted to look at vaginas all day?
You know, honestly, I honestly decided to become an OBGYN when my mom got pregnant with my brother. So I was 9. So we're far apart in the literal sense of the word. But she used to take me to her appointments trying to make me feel included, you know? And that's
That
where
was
the
sweet.
interest was sparked. So I never had to choose. I never was really interested in anything else. And it just
Wow.
fits. It works.
Yeah. I bet. That is why. She'd be looking at vaginas all day.
I just keep thinking about all the science classes you had to take.
Ooh.
I find medicine and being a doctor, like a medical doctor, so fascinating. But all I can do is watch it on the TV because I didn't even have to take a single science class when I got my journalism degree. And I just salute to y'all. Because y'all was up studying and
You know,
working hard.
everybody has their thing. That happens to be my thing.
I love
Yeah.
it. Okay, this might be a dumb question, and I should probably know it, but I don't. What does
Oh, Lord.
OBGYN actually stand for? Do you know what it stands for? I don't know what each letter means.
So it's like a twofer. So the OB part is obstetrician.
Okay.
The
That's
with
GYN,
the babies, right?
and the GYN is gynecology. So that's where you go for like your regular annuals, your pap smears, but then also your hysterectomies, removal of your cysts, things like that, your fibroids.
So you work with all of that, the vaginas, the babies, and the hysterectomies.
I do both. Yep.
Does anybody really do one or the other?
Yeah.
These
Actually,
days?
so you know our generation, we gonna do what we feel like it. So now people are starting to split it up. Just taking OB call, you could just deliver babies and do a couple shifts a month, or you can just do GYN and just see people in the office. Whatever works best for your lifestyle, sis. I say
think I
get it
would
how you
be
live.
The GYN. I need more of a schedule because those babies just drop at any
Oh, they do.
time.
Oh, for sure.
I'm on vacation. I'm in Peru.
And you,
what do you mean?
if that happens, you have to go. You have to drop everything and go and deliver that baby.
Somebody's on call.
So you gotta make sure that you're in a really good call group.
Mhm.
So I'm only on call about 4 to 5 times a month. So it's only about 4 or 5 of my days a month that aren't mine.
Mhm.
The rest of the time, I'm outside. We got a schedule just like
I'm
everybody else.
outside.
Just saying.
The doctors is outside too.
I know they are because I love going outside to meet the doctors. Oh, where do you work, doctor? So nice to meet
You know,
you.
as a female doctor, is it easy to meet male doctors?
Ooh,
What's
good
the tea on the
question.
male
The answer
doctors?
is no. And let me tell you why. So there is some bit of an old adage that the nurses will scope the new male doctors when they
Absolutely.
come in, right?
So they get them.
Girl.
The nurses be
We gotta
nursing.
gotta put up a fight. Now I do have a lot of classmates that got married in medical school. If you find it that way, that's probably the best way. But people ask me all the time, he's not walking in the hallways. Where is he at?
Where's
Because
with the
I'm in the
nurses?
hallway. I'm here, and he's not here.
I feel like I went through all this medical school and I still gotta do shit. Thought I was about to get me one. I really gotta go to the pass the boards and all that. This was just all for, to find a husband, a better quality one.
Not a better quality one.
Because it's trash outside.
It's some in the hospital. Don't let it seem like the nurses take all of them. But
Is
we
working
gotta
in
give
the
it some work.
hospital really like what's that hospital show?
Grey's Anatomy.
Is it like Greg's Anatomy?
You know, Grey's is a lot. A lot happening in closets and secret spaces. I can't say that I've been privy to a lot of it. Have I heard about some of it?
Did you see The Good Nurse?
I saw The Good Nurse. That's
You
a
should
true
go-
story.
Yeah. You should go home and watch it. It's about a nurse who was basically a serial killer.
He was killing the people.
He was working in a hospital, several hospitals, and he killed hundreds of patients. He was poking the IV bags with different things that are clear liquids that were slowly killing them. He had no reason to do it. So there's a movie called The Good Nurse on Netflix. And then there's a documentary. At the end of the movie, it'll pop up the thing. I forget. I think it's called The Killer Nurse.
He
Now,
was
you
just,
know I love a good documentary.
It
now. Don't
was.
get me
I
started.
hate to say it was
He's
good because
crazy.
he was killing people, but it was just like I couldn't.
It was interesting.
There was no reason why he was doing it. He was
And
just
he said
like-
that. He said because they wouldn't stop me.
The
Oh,
hospitals
really?
kept just switching him
It
to
was
different
a
hospitals.
scandal.
It was
Oh.
So
crazy.
you
I
can
was
watch
like,
some nurses down. Well, they're not gonna be doing that because these people were like staying, but still.
yeah, it was wild. All right, Whitney. So before we move on to weird sex and before we get into our topics, we're going to play a quick little game with you. So Kiki and I came out with a game. It's called I'm Curious to Know. If you would like to purchase it, go to I'mCuriousToKnow.com and get it now. We curated some special questions for our listeners and our guests. And so we're just going to go through a few of them with you. Kiki, you want to go first?
Sure. Okay, this is an easy one. Who was your first celebrity crush?
Ooh, Allen Iverson.
Really?
Really? He be walking
Yeah.
around Lennox looking crazy.
Oh, well now, but wait,
That was a long time
Look,
ago.
but
when
wait,
she
but
was
wait.
first. I said first
Because when he
celebrity.
was on my wall in my bedroom,
He was
his
fine.
cornrows was crispy.
Mm-hmm. Now
And,
they
I
nasty.
not so much, but it was Allen Iverson. I mean, everywhere, the jerseys, the everything.
He was fine. He's still kind of fine. He just a little, he just
Life just be
life be life in. Okay. I'm curious to know, Whitney, what do you consider cheating?
That's really relationship specific
Mm-hmm.
because we gotta have titles and we gotta know what we're doing. But I think if you're in a monogamous relationship, y'all committed to each other, then I think, it's a lot that you can cross the line. You could talk to other women for sure. You can, I don't know, DM and gets a little rusty.
When you say talk to them, you just mean like, hi.
No, well, yes, like have conversations. Like you can
That's
hug,
it,
you can hug
friendly.
women. Interestingly enough, I listened to something the other day, and they was like, "My man can't hug nobody." Yes, he can. You can hug people, but I don't want to catch you in like DM conversations, setting up plans with somebody. Conversations through text and
I
stuff.
don't even want you to. I would hate to have the man that is doing hard eyes under every Instagram model's pictures. Stop. What are you doing?
Like what's going on? I mean, I know she's attractive, but you want me to do that?
Calm
and
down.
they
Right.
don't. They don't.
Yeah, I would be hot. I'm shutting it off. I'm reporting everything on your page. Fuck that. It won't be no Instagram.
I've been known to report somebody and get all my friends to do it too.
Okay. Gang, gang. Anyway, okay. What's your favorite porn category?
Oh,
That's a good one. I love that one.
this isn't even a bad one because you should watch porn.
It's a little healthy.
I
This is
did
how
it this
you-
morning.
I
you
did it last
learn-
night.
You learn what you like. How you supposed to know? How we supposed to know?
My favorite category is lesbian.
I think I don't really have a favorite category.
Just whatever pops up.
Actually, erotic massage.
The new room massages where they be all oiled
Yeah,
up.
I'm not even gonna hold you. It's that.
I like that.
I
Have you
was
ever
about to
booked
lie. No, where is the link?
You know, I'm about to see some of these people be doing it, and the men be out here massaging. One of them lives in my building.
Oh, really?
Oh, I wasn't talking about that kind. I know what kind you
I'm
talking
sure
about.
it leads to that. These niggas that be on Instagram rubbing the ladies and jumping on them, spreading booty cheeks, that's porn.
Well, yeah. I was just specifically thinking about the ones where they oil themselves up and then they massage with their whole body. Not the ones that's got Trey songs playing in the background trying to be sexy and make Instagram videos.
Now they got the
But they're
chefs
very
doing it. Have you seen
similar.
the chefs?
I've seen
That's a
them
lot.
fucking
You cook
fingering the
food and
salmon
stuff?
and shit. Just
Oh,
put the
God.
shit
I just want my
on the
food.
grill,
Yeah.
in the oven, on the air fryer. What are you doing to my meat?
Okay. Okay. I'm curious to know, when was the last time you were drunk and what happened?
Very easy for me to remember that. So I actually don't even really drink. This a mocktail, but my friends will be like, she don't drink. Very special occasions. But it was my birthday in 2017.
Mm-hmm.
It went
Ooh,
all
so that was
bad.
a long
It
time
was
ago.
bad. Oh, that
Went all
is a
bad.
long time ago.
Yep, bought a whole new outfit, whole new white shoes.
Is that why you don't
Dated-
drink anymore because of that night?
No, girl, no. It was a
Okay.
bunch of them nights before that. But I have to be ready to go a lot
Mm-hmm.
for work. So I just try to
Oh.
keep it kind of even keel. It's hard to go up and down on a roller coaster and still function good. But no, that night didn't go
That
well.
would be horrible to be on call and you're drunk and you get called to deliver a baby. Now you on the news and
Or
in
even
jail.
yesterday you had a wild night and now you on call tomorrow. It's hard to
You gotta
remember.
pay attention.
When-
Or if you in the middle of your new room massage
Yeah.
with the Instagram niggas that live in your building, and I done paid $675 for this, and
$675.
I don't know. I just feel like they charge astronomical prices.
like,
I
that's
remember that one dude
egregious.
was trying to charge $500 and some dollars.
Mm-mm.
I don't know, but the girls are paying it, so shout out to those young entrepreneurs. Anyway, I would be pissed. That baby gonna have to wait. Squeeze it in, think of the desert. Just hold on tight like you gotta pee. That probably wouldn't work.
It was not really, but
But that's what I would say, bitch. I'm in the middle of a massage.
And you is not an OBGYN no more. They said this
I
your
told
last
you I ain't
day.
take no science classes.
That is crazy. Okay, last one. I'm curious to know, how do you feel about traditional gender roles in a relationship?
Love them. Oh, not me.
Ooh. Well, look, because of the way my schedule is set up
Mhm.
and just my life in general, a lot of that gets thrown out of the window for a lot of us.
What
You know,
mean?
because, we work a lot, so I can't necessarily get the kids, and I'm not cooking dinner, and I'm not, some stuff I can't do. You're going to have to pick up the slack in some areas. We share a lot with our partners because our time is just spread so thin. So I'm not really a proponent in that way. Now, there's some stuff you can't compromise on, like provision. Who is taking care of the bulk of stuff, and, or who at least who we letting act like they take care of the bulk of stuff, right? Right.
Well, I need you to for real do it.
Yeah, I just they know.
I ain't no OBGYN. I'm a podcaster.
Right, so you gonna have to pay these bills, nigga.
Because it's only so many years.
I will cook and I clean and I make you tacos.
And it's gonna be
but-
real good. I'll cook all the meals. You forgot your lunch, I'm on the way. 'Cause
See, y'all good. I ain't cooking nothing. I'm gonna act confused about how
That
the
makes
stove
sense.
works.
So
it
you
makes sense. You're saving lives and delivering lives and
making sure
important
vaginas are
shit.
healthy to be
we
out here
talk
having.
shit every week.
Yeah.
For a couple of hours. The least I could do is make a little meal, a little pork chop sandwich, something.
Rub your baby. Rub
Do you
your
watch?
feet, baby.
Do you watch Married to Medicine?
Yeah.
I love that show. I was thinking about that when you were talking about the roles being reversed because the two OBGYNs on there, their husbands are not doctors and they be complaining.
Are their husbands just like regular 9-to-5 guys?
Yeah, one of them was a high school basketball coach and the other one worked in sales for Coca-Cola, and that one ran off with her money. I would have been pissed. Well, he didn't run off with it, but he invested in some bullshit. I'm sorry. He invested in something that he thought was a great idea.
She crazy.
But I was mad with Dr. Simone. Yes, I was, because how you take my money I earned. Anyway.
You know, we had a therapist on last week. Whitney's like, okay. We had a therapist on last week, and we asked her about like dating as a therapist and like, can it be difficult sometimes because people just want to like tell you all their problems.
Unload.
I feel like most of the time when people hear doctor, they're like, oh, you're rich.
Yep. That's it.
And when you meet men, are they like, oh, Oh,
I got me one.
I got me one. She about to
Absolute
buy us a
turn-off.
house.
Big money.
Big.
know,
Oh,
people
don't you
say-
hate when they say that?
You're like, oh, who is that?
Oh,
Where's she at? Super big turn off. Probably won't contact you again.
That's
Thank
wild.
you for your time, though.
Mm-hmm.
It happens a lot.
Mhm.
It's not a wild assumption, but even still, it's mine money, right?
Right.
And how much do
Amen
you
to
have?
that.
Because we need to add it together.
Mm-hmm.
So it is difficult. Be honest. That and your time, right?
Oh.
So how often can you really go on a date every night of the week or?
So what is your work schedule like? I never really thought about that.
Not bad, but this is all based upon where you work. So I work 9 to 5, regular office hours, and actually one of those days I actually work like half a day, so 4.5 days. And 1 day a week I'm on a 24-hour call. So that means I see patients in the office for a half a day, and then I could go home and go back when someone's in labor.
And someone is going to be in labor.
For sure, I deliver about 7 babies a shift.
You just tossing babies out like nuggets. Next. Who next?
I mean, y'all called each other in the pandemic and made these pregnancy packs. I don't know what's going on.
I didn't call nobody
Oh,
but
I
that.
ain't
And as a
either.
matter of fact, I called somebody recently and I said, you better not fucking get pregnant, bitch. We got a fucking tour.
Kiki told my boyfriend that. We had
I
a live show.
did.
He said, Kiki pulled me aside and said, I better not get you pregnant. I said, nigga,
I
you
sure
better
did.
not.
And I'm going to
Well,
keep telling him every time I see him.
Don't
just a
say you didn't know.
reminder.
Hello?
Okay.
Wow, 7
Got work to
babies?
do. That's a lot.
That's a
in
lot of
one
little
day.
babies.
I bet your back be hurting like, damn.
Not my back.
Yeah, I'm just thinking like, of course, I don't have children and I have no desire to be in that delivery room. But when I see it on the television and they're down there trying to look and see and you getting in all them crevices and then the stuff gets wild down there and those babies are coming out, whew, I just feel like my back would hurt. My back hurts in the kitchen, so.
My back
just
hurts in the
hurts.
kitchen. Maybe that's why I can't do it.
Okay, we are going to move on to weird sex. When we come back, we're going to dive into the topics.
You said a man is not a necessity, a man is a luxury.
Like dessert. Yeah. A man is absolutely not necessity.
Did you mean that to sound mean and bitter?
Oh, not at all. I adore dessert. I love men. I think men are the coolest. But you don't really need them to live.
Okay, so this week's Weird Sex is about somebody who I guess had a kink. Necrophilia, I've talked about it a long time ago. That's when people like to have sex with corpses. So check this out. In sunny Florida, you guessed it, a man was found dead after being caught sexually abusing a corpse. He worked at a funeral home. And the police were called to the Oaklawn Funeral Home in Pensacola because another employee walked in on this man abusing a corpse. So he gets
That's
caught.
crazy.
He flees the scene. The police get there. He's gone. Then they get a call that there's a body at an intersection, and he was laid out next to a vehicle with an apparently self-inflicted gunshot wound. After all of this went down, and it's just like, you went in there and raped this dead lady. Then you ran out of the funeral home, caused a traffic accident, killed yourself, and just laid out there for everybody else to clean up the mess. I just think it's so disrespectful and it's so crazy. And the kinks that people have, I know y'all be telling us don't be kink shaming, but this is a very inappropriate one. Like, the person is gone. Why are you doing that? And I feel like I've done a few stories about people developing infections and things after playing around in these dead, but they're dead.
Yeah, that's nasty.
Let them rest.
Oh.
Isn't that disgusting? Anyway, the funeral home didn't say who it was, but I was like on the New York Post or something, and they were giving all the details about everything. They said he was on North Blue Angel Parkway, and they was naming the streets and everything, y'all. So just be careful and maybe don't send your loved ones to the Oaklawn Funeral Home because they are not keeping a close eye on your loved ones because he was in there fucking them.
That's wild.
Isn't
That
it?
is not okay to do.
Hey besties, are you looking for an easy way to eat well and save some money? Cut back on expensive takeout and delivery and get started with HelloFresh. You're going to absolutely love how easy, fast, and affordable it is to whip up a restaurant quality meal right in the comfort of your own home. HelloFresh has pre-portioned ingredients and easy to follow recipe cards, which means you get a delicious home-cooked dinner on the table without all of the time-consuming meal planning or prepping. I have been using HelloFresh for quite a while now, and I really love it. As much as I love to be in the kitchen and cook, sometimes with my busy schedule, it's so hard to find the time to actually figure out what I want to make, figure out all of the ingredients, shop for everything, check my pantry, all of that. I don't have to worry about that with HelloFresh. I just go to the website or use the app and I select my meals. There are over 40 weekly recipes to choose from and they change constantly. You can select your delivery day to fit your schedule. It makes it so easy. I like to have mine delivered on a certain day when I know that I'll be home so that I can unbox everything, put everything in the fridge, and know what I'm making for the week. The meals are really, really good. I personally love the creamy coconut curry chicken dish that I just made last week. It was so tasty, and the best part about it, I didn't have to worry about having too much of an ingredient that I would barely use. I didn't have to think about what I was making really because the recipe card just walked me through it, and it was so quick and easy. It was literally like a 30-minute meal. And another thing that I love about HelloFresh is that I know that the ingredients are going to actually be fresh. They're going to make it from the farm to my doorstep within 7 days. Whether you're a vegetarian, you don't eat pork, you're trying to cut back on carbs, whatever the case may be, HelloFresh has something for you. You can swap out proteins. Again, you get to select your meals, which is my favorite part. And it comes with pictures so you know what to expect. And it's really kind of fun too, just to try and make these different things that you probably wouldn't have come up with on your own. I want to make your life as easy as mine has become with using HelloFresh. So this is all you have to do. Just go to HelloFresh.com/cocktail65 and use code cocktail65 for 65% off plus free shipping. That's right. Just go to HelloFresh.com/cocktail65 and use code cocktail65 for 65% off plus free shipping. COCKTALES 65 for 65% off plus free shipping. HelloFresh, America's #1 meal kit.
Okay, Dr. Langford.
You sound like Bridgerton.
I felt like it too. And the name Langford just sounds like Langford.
I thought of the Lannistons. What is it?
Lannisters?
Lannisters from the
Game
other
of Thrones.
one.
So I posted a post on our Instagram story and I was like, ladies, I want to make sure that we really ask specific questions for this episode because you are OBGYN. And people had questions. I wasn't sure if people were going to have questions. I know Kiki and I could have come up with our own questions because I always got questions about my vagina. But these bitches had questions.
And my ovaries, they just be,
And periods.
I'm ready for them to go.
And that cramp you get in your booty hole when you get your period, why do we get that?
You don't like that part?
No.
You like that part?
It hurts. It hurts so.
I don't get the booty cramp, but I get all the cramps.
I don't understand why sometimes it feels like there's a Charlie horse in my butthole.
Yep.
What? Do you know what it is?
So, we just have a lot of things going on at one time. During your cycle, of course, you have uterine contractions, but that can stimulate your bowels to actually contract as well. So your rectum is the end of your bowels. You're going to have some spasms in that area. You also get a lot of diarrhea with your cycle and things like that. So you got a lot of muscles trying to do all the work
So
to
it's
keep
a
things
spasm.
together.
Oh, this whole time I've been calling it a booty hole Charlie horse.
Okay, that's nice. That one's
She
nice too.
still is. I already know.
Yeah, I was like, yeah, that's a nice one.
It just sounds better. But so, one of the questions that kept reoccurring on the Instagram page was people wanted us to talk about cysts and fibroids and how do you get tested and what are the signs that you should be tested?
Okay, so this is actually something I encounter a lot. So if you ask me on my surgery days how many myomectomies or fibroid removals do I do, 1 every surgery day. Super common in African American women. Honestly, the research as to exactly why it happens is not there because it happens to African American women, right? And we're always the last on the list. But if you have your normal annual exam and, we do the bimanual part where, our hands on the inside, we're doing all this pressing, y'all are like, what is going on, ma'am? Please. That's the part where we're feeling for the shape and size of your uterus. So if your uterus feels enlarged, we may inquire, like, have you ever been told that you have fibroids? Have you ever had an ultrasound to evaluate that? So if your doctor asks you those kind of questions, it's kind of prudent if you just go ahead and get an ultrasound, okay? Now, a lot of women will have very heavy cycles or painful periods. That may be a sign that you have uterine fibroids that needs to be removed. I encounter this a lot because a lot of women are trying to get pregnant, and fibroids, depending on their location, there are 3 main locations that they could be located, but if they're inside the cavity, they can prevent the baby from implanting or from you having a successful pregnancy, like baby being able to grow. So those are the reasons why you should be evaluated. Should everybody just get a pelvic ultrasound? No. Okay. Not if you don't have, any of the symptoms that I described or any issues with your cycles. But what is a normal cycle? A normal period is like 3 days. Light bleeding, only using a few pads a day. Exactly. Not 7 days, passing blood clots, changing your pad every 2 hours. That's a lot. That's excessive. Really? We've gotten used to accepting that because, everybody does that.
Very expensive.
Yeah, everybody has a period like that. So I thought my period was normal, but that's not necessarily true.
I did not know that. I thought my period was normal.
Yep, well, okay. I don't have periods.
I know mine ain't.
And then the cyst part of it, that's the same thing. When we do this exam, we're taking a feel to see if we feel if there's some enlargement in what we call your adnexa or the sides by your uterus. Now, sometimes women have pain. You can have ovarian torsion where the cyst turns itself and cuts off the blood supply to your ovary. You have
pain when you have sex, or you just have pain all day?
You have pain when you have sex, this sharp pain that comes out of nowhere. It could be a myriad of things. But if you ever have pelvic pain and, there's no reason for that, you need to be evaluated in some kind of way.
What's the difference between a cyst and a fibroid?
So cysts are on your ovaries. You should have an ovarian cyst every month when you ovulate. That will be normal. Because what happens is the egg is expelled and then it leaves behind a cyst, which secretes a hormone to keep you pregnant. Your body realizes, I'm not pregnant, and then the cyst goes away. But for some women, it persists and it keeps filling up with fluid and becomes very large and painful. Fibroids grow in the muscle of your uterus or on your actual uterus, ovaries on the sides. So 2 different places.
Can men get these?
Of course, girl.
That's not fair.
Can men get anything? No.
That's not fair.
Nothing but get on our nerves.
Right?
And give us diseases
like, get a what?
and fuck up our pH balance. Things like that. I wanted to talk about that because a lot of times different women will complain about switching partners and everybody wants to blame everybody else on why things are off down there. But I wanted you to tell us, like, what are some things that can throw off the pH? And then there's so many products out there, and everybody's saying, wash your pussy with this, wash it with this, wash it with this.
What, suppositories.
What do you say to all of those things?
So vaginal hygiene is like the hottest of topics. I mean, we have multiple patients every day who are complaining of, some sort of discharge, itching, or odor. So the main things that are going to throw off your pH is being moist down below for excessive periods of time. You want to stay dry. We always talk about cotton underwear. That's kind of old school. People don't really, go to the store and you be like, give me the good cotton crotch. Nobody does that in Victoria's Secret. Like, where's that?
You're saying we should have a cotton crotch?
Yes, you should. It's good for you. Keep things aired out. You want to cut down moisture in that area. When you work out, sitting around in your workout clothes, right? People always talk about them tight jeans. You're going to get a yeast infection. Well, it's not really that they're so tight, but they're just cutting off air circulation. It's moist, it's warm down below, and yeast love a moist, warm area. You ever seen bread rise?
I have.
Okay, welcome to a yeast infection.
Have a little bread factory between your legs.
Oh, hello? So those are the things. Washing in all of these fancy soaps. Now, I know we love, to support. We have Honey Pots and we have Summer's Eve and Vagiseals, but it's really not necessary.
Really? So even when they say this is for your vagina.
Right. They're like pH balance for your vagina. Warm water, a good cleanse on the outside of your vagina. I mean, wiping good, like wiping in between all the folds will keep you regular for most women. Now, I'm going to be honest. I wash with Summer's Eve. Because it's just like a little tropical smell sometimes. But
you don't get inside.
You absolutely do not put
vulva,
anything inside.
not the
yes,
vagina.
Outside. No fragrance sprays. They got all these wipes and stuff. You don't need all that.
I feel like a lot of the times the women that are using that, it's because you're trying to cover up an odor and you need to go to the doctor because you probably have bacterial vaginosis.
Or something else.
What else stinks? Isn't BV the only one that
Girl,
stinks?
No.
Which other one stinks?
You could have trick. You could have gonorrhea. Trick smells like BV.
Oh.
Trick is very tricky. Okay.
Trick daddy.
Okay.
Some people will think they have BV and it's that. It's
So-
tricking on something, but trick.
Yep.
Is
Trick 'em.
BV considered a STD?
Yes. So gonorrhea, chlamydia, trichomonas,
Mhm.
HIV, syphilis.
Mhm.
Those are going to be your hot ones. HSV or herpes.
But BV.
BV is not. And yeast is not.
It's
That's
not.
vaginitis. That's an infection of the vagina.
But men can pass that around.
So they can unknowingly, they don't know, what bacteria that they're passing to each other. That's why we want you to use condoms especially if you're switching partners. That's one thing that's going to protect you. Interestingly enough, semen can actually worsen the smell of BV. So a lot of women will say, well, I have sex and it's just awful after I have sex. Yeah, because that's what's setting it off.
I'm telling you right now, I don't know if you heard about the streets. They're talking, and BV is really hot on the streets right now. And people are walking around smelling like little goldfish. And it is bad.
What the fuck does a goldfish smell like? Who has ever been able to pick up a goldfish and smell it? Like,
They
what?
just smell like little fishies. And we have had men on the show, and there was one guy that was on, and I was like, he was talking about women smelling like fish, and he was saying that it's a normal smell. Like most of the women that he has had sex with, they smell like fish. Nick Cannon did an interview too, where he was like, a lot of the women that I've had sex with, they smell like fish. And I was like,
And it never stops them.
and it
never
never
stops.
And
Nothing
that,
stops them. Be
if
very
you've
clear.
ever had BV, I struggled with it for the longest time. And I was like, oh my gosh, it smells like sewage and fish. It is horrible. And
It could be pretty pungent.
but why is there no cure for it? Why is it like if you get it, you keep getting it?
Because the thing about it is it's just your pH balance. Until you get it back in balance, it's not going to go away.
Can what you eat throw off your pH balance?
Not necessarily. We haven't really been diet specific. I mean, not drinking enough water for sure. That can be something that sets it off. But you just want to keep a very clean environment. And for some women, that's 3 showers a day.
Oh.
For some, that's 2. For some, that's 1. But whatever that is for you, we're going to have to find it, sis, because enough is enough. It's interesting that you brought up that interview where they said all women smell like that. I'm pretty sure y'all saw Kevin Gates talking on.
I usually just press sound
Child,
off
it's
when
a
I
lot.
see him.
It's
on
a lot.
TV.
But I tried to watch a little Carisha Please or something.
What did he
child.
say?
He was all over the place talking about womb washes and sanitation. But he says that his women don't smell like nothing. And that's what I'm talking about. And they taste like water. So we got men having different experiences out there. And it might be different women.
Have you seen those those yoni pearls that the
Yep,
people do,
don't
and then
put
they
that
put
in
all
there.
that stuff? And what is really happening?
Don't put
Oh,
that
when the
in.
stuff comes out?
Yeah, what is that? Because
happening?
sometimes I'm like, is that just a bad reaction? Your body is like, get this shit the fuck out of me.
What is it?
So it's a little pearl and it's on a string. Inside of that, though, can be different herbs and such. So obviously, if I just told you not to put soap up there, sticking an herb ball of
It's
God
not a good
knows what is not it. It will bloom, like it will open. So when you go to pull this out, you're like, ew, what's this stuff on here? Some of that is discharged, but some of it is just what was in the actual ball.
It's just
And
moist now.
Right. And now ask me how many times has that gotten lost and I had to go find it for you.
I was just about to ask you that because I'd be mad.
the
And you
string
gotta
came
be
off.
digging in there and
What's the wildest thing you ever had to take out of somebody's vagina?
So I'm gonna tell you personally, and then I'm gonna tell you what I heard.
Okay.
So personally, there was a young woman who got in an accident. So her leg was broken. She had forgotten that she had stuck something up there. So over a week later, they called OB like, "Oh, you need to come get it out." Saying you need to come and get it out.
Yeah.
So it had been a tissue wad up there for about 2 weeks, and I don't know if
tissue wad.
you've ever smelled the
Death?
circus or
Yes.
farm animals. I don't
That's
know.
what it
Safari.
smelled like?
It was.
Was she embarrassed?
A little.
Did you have to fumigate your office?
It wasn't in my office, child. This was in the hospital.
Okay.
But what I've heard, and we talked about little fetishes earlier, tuna fish.
Tuna fish?
Wait, like the food or like the actual swimming fish?
like a
Like
spicy
the,
tuna roll.
The fish, like I made a sandwich
Why was what?
because they wanted him to eat it out. What do you mean?
Do you guys, when this happens,
No, you fucking lying.
or as a doctor, are you like, what the fuck were you doing? Or you can't do that. You'll
I'm
be in
just
trouble.
like,
Give me your
so
phone,
tell me
call your
more
mom.
about what happened. So how many scoops? And then about what time did
And you got to
do-
keep a straight face.
Did you get any of it out? Were you successful in actually reaching any of it?
Are they embarrassed?
If I put tuna fish in my vagina, do I really?
That's
really
gonna be the
care?
ones on ZocDoc talking about she had a terrible bedside manner. Like, you put canned tuna fish in your pussy hole, and you wanted me to keep a straight face?
That is insane.
I'm-
Have you ever gagged because something smells so bad in between somebody's legs? Or you're just used to it?
Or you just put your mask on so you don't.
Well, now we
Oh.
have masks to protect us, so not so much anymore. But have I ever? Yes. But I will tell you that a vaginal smell hasn't been the worst smells that I've smelled.
What's
the
the
worst
worst
smells that
smell?
I've smelled have been like
Birth.
in the emergency room and, weird stuff in the ED. Like, not vaginal stuff. Maybe I'm just immune to it. You got to throw a lot of me in the office for me to be like, oh my gosh.
Have you ever been in a room and like you smell a fishy smell and you're like, sis got BV or sis got tricked? You can pull her aside and be like, hey, listen,
No.
here's my card. You're lighting up the room and I know what you got.
No, I have never.
Oh.
I have never. That's interesting
thank
because I had a friend who asked me that. She was like, well, are we comfortable enough to tell each other? Like, sis, I smelled your waft. When you sat down, you got to go see somebody about it. And I don't know if we're
I don't know if I would be able
comfortable.
to tell somebody that.
I don't know if we
I
made
wouldn't.
it that far.
Yeah.
Yeah, exactly.
Yeah.
Because now she wants to go home.
She's like,
We're at dinner.
let me
and-
excuse myself.
Yeah. and
I
and
didn't
it-
smell it. How long have I been smelling like this? I'm immune now because I've been
'Cause
walking
I
around
haven't
like
even
this.
smelled it.
I didn't mean to walk
Exactly.
out the house
Well,
like this.
when I've been a little stanky, I know that I'm stanky. Like, you know you stank. You just want to still come and have brunch.
But I'm thinking like somebody might have been walking around like that. They might have been thinking like these men that you're supposed to smell a little fishy and it's normal, you know?
That's true.
Ooh, the
That
blind
is,
out
ooh,
here.
that bacterial vaginosis will get you every time.
I have a question about egg freezing.
Yep.
So how does that work? And like, is everybody really a candidate for it?
So, interestingly enough, I froze my eggs in November.
Mm-hmm.
I did my retrieval the day after Thanksgiving. So, I talk to women every day about freezing their eggs. And for the longest, I was like, the Lord didn't tell me to do that. I was like, I'm just not doing it. But life happens. And last year was a really rough year. And because I had some big life changes, I decided to go ahead and do it. It was very intense.
Does it hurt?
No. A lot of discomfort, though. Your ovaries become very large. You get a lot of symptoms as if you're kind of going through actual pregnancy.
Oh, wow.
And all of this is like compacted into 2 weeks. But it was 100% worth it. I feel like I can just live my life now. You know, everything's great. I got 15 eggs, which is a nice average number. They want you to do it by 35. That's the recommendation by reproductive endocrinologists. So that's a specialist that do fertility. I was 36 when I did it. I'm 36 now. The reason being is because we know that your egg reserve or how many eggs you have goes on like a roller coaster. The top of the roller coaster is actually like 30 and you start coming down. So 35 is already on the downslope. Sis 40 is down here. And 50, we're at the bottom. So we want to do it when we actually have a good reserve. You want to get good results. You don't want to wait until you don't really have the numbers. So the way to know if you're a candidate is to get your lab work done, get an ultrasound done. Just go for a consult. If you're on the fence about it, I don't know if I want to do this. Go for a consult, see what they say. And if you feel like it's something that you can commit a month and a half of your life to do with these medicines and these shots, then go ahead and get it done.
Now,
How are you going to pay for it?
I was about to say, is this a rich girl activity or?
Yes.
So rich in the sense that it does cost money, but as in everything, it can be financed.
Somebody told me like you got to pay rent for your eggs. Like it's $10,000 a month.
No, it's not. It's $60.
Whose rent is $10,000 damn?
Exactly.
Say?
Exactly. It's $60 a month. And
If you have health insurance.
no. This is
Oh.
all this is out of pocket. So my health insurance does not cover it. A lot of people's insurance and jobs do now.
Okay.
So they will pay for your medicines at least or pay for such and such at least. So you just want to see what they're offering. But I paid about $11,000. Then I had to out of pocket another $2,500 because I was really aggressive with the medicine because I wasn't doing it again. One time, that was it. So about $15,000.
You have tricked off on your children.
I did.
And when they come here, I'm gonna be like, listen, Apple and Olive, try me if you want to.
That's what she want to name her children.
that's-
You know how
child.
much I
That's
paid to
cute.
even have you
Is
here? I
it?
didn't even know your daddy yet, and I
Yeah.
was tricking.
So the thing about it, it's worth the sacrifice. It's worth the peace of mind to me, right? Because
Especially if you know you want to have children one day
Right.
and you're not there.
you get desperate, like, oh, I'm just gonna settle. I'm gonna make a decision because I have to do it. Now I don't have to do it. If I say in my mind by 39, I want to make a decision. Even if that means that I get a donor, but I'm gonna make a decision about what I'm gonna do to the eggs. I did not give anybody $15,000 at one time. I'm still Black, and I
Put it on
will-
that payment plan.
You can finance it. That's the short answer to the
I
thing.
didn't know
they have
that.
financing, and the Lord will work it out.
And so they just have them in a little jar somewhere in a freezer.
So they have them frozen in liquid nitrogen in the freezer in these containers, like labeled, specially put away for you. When you're ready for them, they'll pull them out, and we can make some magic. You may not ever need them. And for me, that was special because if I don't need them, I wanted to be able to donate them to a woman who does not have her own eggs.
You know,
That's
we
very
learned in
special.
a past episode, we had someone on, a friend of mine, her name is Melissa, and she was raising money to, is it called IVF?
Mm-hmm.
She didn't have eggs.
So she was doing IVF with donor eggs.
Yeah.
Yep.
So, and she was saying it was really hard to find Black babies because a lot of times when I was growing up, I was never told like donate your eggs when they're healthy. Like
Very lucrative.
yeah.
I tried to do it when I was poor. I did, and that's how I found out that my eggs were no good.
because you were
Well, not
past
that
the
my
age.
eggs were no good, but I had all these cysts. I did the vaginal ultrasound,
see.
and I found out that there were all these cysts. So I was like, well, fuck, well, good. I guess that's why this shit didn't happen before. Thank God. But yeah, I remember that.
Yeah, she was saying it was really, she finally found a place, but she has to go to Barbados to like get, she wants a brown baby.
African American sperm too,
Yeah.
very low. So we want
People are still stealing babies too. Y'all watch your babies when you have them in the hospital.
Jesus help us.
Give me my baby right after she comes out of my
Well, we
vagina.
do room in now. There's no nursery, so your baby
Good.
will be with you 24/7. Baby friendly hospitals is what we have.
Yeah.
Georgia.
Because I want my baby right there. Are vagina steams bad? I actually enjoy them, but I just started getting them this year. I've only had one, but like I enjoy.
You said it like you have been going
like,
faithfully.
like I have appointments
I
every
love
month.
vagina steam. Well, I only did it
So
once, but
And
liked
honestly, I've had one too. It didn't do nothing.
You know, I'm not, it just felt good.
Okay, it's just
I
hot,
like when
hot
a man is
steam.
down there with his hot breath.
A man steam.
You have to be
Yeah.
careful because there have been instances where it's been too hot
and your
women
lips
have
get
been
burned.
Now the actual benefit of it, we can't say because we not really, the OBGYN is not gonna be like, girl, get you a steam. We don't know the benefit of that.
Y'all are like,
Could
don't
you
just get a
imagine?
washcloth.
just leave it. Yeah,
And
you
burned
can get it
up your
really hot
pussy.
in the vagina, in the shower.
Yeah, my shower gets real hot. I be turning pink when I come out like a little lobster. And I'm like, yes, I steamed up this body. But could you imagine like burning your pussy lips?
Yeah, it's awful.
Ooh.
My pussy lips got burnt with wax. One time I was getting a wax and it was too hot and it was the most painful situation. I was like, because she still had to rip it off.
Yep,
What
we've
happened to
seen
my
that a lot.
lip?
We've seen Clorox bleach.
Chloride.
What is they doing down there
Well,
with bleach?
Cleaning their sex toys and they didn't rinse it off good. But that's a different.
With bleach? I ain't never used. There's sex toy cleaner. I know you be
And
annoyed at work. I would be like, why did I get called in for this?
Just be careful, guys. I mean, I just really want you all to be just.
I'm going to be careful because I do not want to be on the news. And they're going to be like,
The news.
yeah.
I don't want to be in the ER. And I don't want to become a story when all the doctors get together. Let me tell you about this patient I had. And this girl
You gonna
got
have
the
to
nerve. I
tell the
saw her on
story
Instagram.
a bunch of times. You are.
Yeah.
They're going to be tagging you in the ER, taking pictures of your pussy. Kiki says so is in here with burnt pussy lips.
And look at her
No.
talking all this shit on Instagram.
Right.
I just seen her pussy lips earlier. Don't tell nobody.
Right. Now, one young lady sent us a message and she said, is it possible to have an allergic reaction to your partner's saliva after oral sex?
This one's interesting. I don't think so, my love.
You can't.
What about an infection? If they had an infection
So
in
yes,
their mouth,
you can get infections in your mouth and pass them vaginal, oral, or penile oral. It's just how we get herpes. You know, it used to be a difference. Like HSV1 was your mouth, HSV2 was in the genitalia. But now because we have oral sex so much, it's both. They're everywhere.
Well, I mean, like, they got a rotten tooth in their mouth and they was eating pussy,
no.
and then maybe some of that bacteria is moving around and it's causing a funky.
Well, first, I just want you
thing.
to always check the back tooth,
Mm-hmm.
okay, on everybody.
And the side.
Yeah, the side one too. I'd honestly, that would be a deep dive for me to see. I would suspect so.
Mm-hmm.
But I just also don't want you eating crawfish sandwiches and such right before. You know, I just
So you should brush your teeth before you give somebody
clean
head.
your mouth a little bit.
Now,
Now
don't have cayenne
we
pepper
do-
coochie.
No.
Neither.
We don't want you to brush vigorously because you make micro tears in your gums, right?
Mhm.
So then you go to have oral sex and you can actually get an infection easier. So it's a balance.
We're just out here nasty. So really, we shouldn't be doing all this. We're
Well, I still am. I'm
Nobody
just gonna
said
take these
that.
tips and tricks with me on the road. Okay.
Can you get infected from swallowing semen
Infected in your throat, yes.
or your stomach?
Or as I like to say, throat. Yes. You can pass infections on any surface. It's a mucosal surface just like your vagina.
Mhm.
So kind of made up of the same tissue. So yeah.
Oh, that makes
I
sense.
would be so pissed. You gave me gonorrhea in my throat, nigga.
Absolutely.
The fuck?
Like,
I
you
would be
can't
pissed.
kiss
You
your
can
nephews
get
and
HPV in your
nieces.
throat and get throat cancer. Like the same HPV that causes like cervical cancer. Yeah.
How does one get tested for that? Like, how
Never
would you
second
know
dick
if you
again.
had throat gonorrhea? Or throat?
You would know.
Okay,
Mhm.
it's hurting.
Yep.
It'd probably be just like down there,
Yeah.
but in your throat.
Okay. Okay.
You would definitely have some symptoms.
Have you ever had someone come and get tested and you're telling them they have an STD and they're like, "There's no way I have that."
Absolutely. I've taken people to the microscope so they can see.
What they mean? There's no way. Which I'm telling you what the lab said.
And you're probably looking like, "Well, talk to your husband."
Talk to whoever you need to talk to or Jesus. But yeah, I've absolutely had to walk people to the microscope. Let's just take a walk so I can show it to you. Because trichomonas actually swims under the microscope.
Oh!
So let me just show you.
Oh my God, sex is nasty, but I love it.
So what happens when we see these stories sometimes, and I've done a couple of weird sex stories where there are like these super versions of the different STDs. Like there's a super gonorrhea, super chlamydia, and they say, oh, the CDC says this, watch out for this. What y'all do when that comes in the office? Is it like, oh, hold on, we got to get the hazmats out?
Not the hazmats.
Ooh.
So we will encounter resistance, right? So at a certain point, they're becoming super variants. They're like, oh, we can fight penicillin. You're going to have to come stronger than that.
The STDs is in there working out
Where does that
ready
be
for
coming
you.
from?
They're like,
Yes.
run up.
Radioactive sites? Like, what's going on?
But what happens is we treat you and then we test to make sure it's gone. It's called a test of cure. If we've done that multiple times and we're not seeing a response to the medications, we will actually send a sample to the CDC.
To see if you got a new variant.
Yes.
Now, do they be lying? Because I met a guy one time and he said that he kept getting chlamydia, but really he was lying to the doctors because he was still fucking same person, hadn't
Exactly.
told him and all
Exactly.
of that. That happens a lot. Why do people be doing that?
Because they're embarrassed.
But stop doing it. You gonna keep the disease. You're suffering.
Well, now we
Yeah.
like to do expedited partner treatment. So if you come and you say you have something, we're going to treat your partner too. After we make sure that they don't have allergies, we talk to them and get their information. It's very important because a lot of people don't have doctors. So you may have a doctor, but your partner doesn't. So where does he go to get the
What
medicine?
if he doesn't have insurance, but you do?
You can go to the health department, but the easier way is just to prescribe him the medicine, right? He could just pick it up from the pharmacy.
Could
After
you
we've talked to
imagine
him.
being contacted, Kiki, and you don't even know, like your partner got something,
I
and
don't
the
know his
doctor's
name.
like,
Oh wait, what?
the partner's like, hey, listen, Omar came in, he gave us your information, he has the herp, and we're gonna go ahead and send you a prescription too. And you're like,
So this nigga didn't even have the decency to
"Ma-
call me and tell me.
ma'am, you can pick up your
Is
prescription
he
at
still
2.
there? Is he still there?
Hey, ma'am, you can pick up your prescription until you have herpes.
Not the one fighting.
The
in
prescription ain't
office.
gonna fix it. I'm pulling up to the thing. We are about to be. It's gonna get really ghetto.
Not the one
We're
fighting
just gonna
in
be.
the office.
I'm not
people
gonna fight.
fight?
I just want to scream at you. Like you had the office call me.
That's wild. I know that probably happens a lot. Ooh,
Somebody did call me and tell me that they had it. I didn't, but he did. And I was
Wow.
like, well, first of all, what you calling me for? It's been a long time, but thank you. And I was glad he told me.
um,
This needs to know information.
Because what if I did? That would have been fucked up, and I would have been like, well, where did I get it from, Jesus? What's going on?
I mean, well, Mary got pregnant by Jesus.
No, she did not. That's not how that story goes. But we gonna forgive you.
That's
We know
not.
you don't.
Thank you for catching, because that's
Yeah.
not it.
Who had Jesus?
Mary had
him,
Jesus.
but
Mary
she
had
didn't.
Jesus. Who
She
get
didn't.
pregnant
By God.
Yeah.
Oh, well, it didn't make sense.
That's okay.
All right, moving on.
Help
What was your
us,
other question?
Lord.
I wanted to know, and I thought about this on my drive here because everybody just leaves the booty hole out. And OBGYN, I thought the B stood for butt.
No, you did not.
I didn't. But if somebody has something wrong with their butt, do they tell you, or is there a specific doctor that they need to go to?
So it depends on what the concern is. You know, I see hemorrhoids a lot.
Mm-hmm.
You can have hemorrhoids during childbirth. Actually worse than during childbirth. And that's
Childbirth
something that
sounds
I can
less
help you with.
attractive.
But sometimes hemorrhoids get to the point where they can become strangulated or fill up with blood, things like that. We would have to refer you to a general surgeon. They do a lot
booty
of
hole stuff.
or rectal work.
Rectal work.
Mhm.
Oh,
That's why I don't even
rough.
play around back there.
I
I
be
don't
playing,
even-
but by the grace of God, I've been blessed.
Okay,
You've
let's.
been doing
That's
something.
why we call Whitney my butthole.
And I'm gonna be like, I told you not to do that. So
I just like to poop out of it.
Sex
I like to
is
inspect
a dangerous
It
place.
is.
Have you ever had people bring their daughters in and they think their daughter's a virgin and they're not? Can you actually tell if someone's a virgin when you're looking in from that end?
So that's not a true statement, right? We use this hymenal ring thing, but sometimes your hymenal ring remains intact. It's not a clear science. Like you look and you're like, I just know.
Mm-hmm.
What we want to do is maintain people's privacy. We want to make sure that you feel comfortable. So we're going to ask your parents to step out. That's your safe space.
No matter
to tell
how
us
old
the
they
truth.
are.
Right.
Wow.
Because they have privacy. In that regard of your life, you have privacy and the chance to make your own decisions. Now, sometimes parents don't want to step out, but
I
we
can only
really
imagine.
encourage them to just give us a moment so we can, really gauge what's going on.
Mm-hmm.
I was blessed to have a mama who didn't need to step out.
Mine didn't need to step. I
We
was just
just
like,
talked.
you know, yeah.
Well, my mama didn't have to, but she did. And I was like, well, you probably should have waited
Step
a
back
few more years.
in.
Yeah. My days weren't wild, but I've also seen stories too where kids, like some of the weird sex stories, kids are pregnant and they needed that parent to step out so that they could freely talk to the doctor about who had been having sex with them, because it wasn't like it was their little boyfriend. It was their mama's boyfriend or something like that.
That's
So
horrible.
I get why the kids need some level of privacy.
Wow, that's so scary. Well, that was all of my. Somebody asked about uterine ablation. I don't know what that is.
Uterine what?
So that was an interesting question because that's very specific.
that
So
sounds like you need to talk to your own doctor.
well,
She was like, I don't have insurance. Let me ask them.
Oh,
real quick.
okay.
that's the treatment for heavy menstrual bleeding.
Oh, I got that.
But only in the setting that you have a normal endometrial lining. So we've ruled out endometrial cancer or other causes that need treatment. So what it does is essentially ablates or burns the lining of your uterus so that you stop bleeding. Now the time
How
period,
you get that?
the time period that you stop bleeding varies. So some people it's a few months, other people it can last for a few years. But it can be effective, especially those who are almost menopausal because you're going to stop bleeding anyway, right? But that's how that works.
Is that an expensive procedure?
It
And can you
sounds
ask
like it.
for it?
There are other ways to stop bleeding. I
Like
don't have
what?
periods. I have an IUD.
Okay, besides that.
See, look, and then it was
Wait, why don't you want an IUD?
My sister had a bad experience and I'm kind of scared to try it. I don't want to pass out or but I'm not totally opposed. I have been toying with the idea of getting one. I don't know.
I would give
I
you
don't
an
like
honest
the
review
pills.
about pain. It's
Okay.
not very painful. There was one portion where I was like, ooh. And then
Well, I'm sure it can't be worse than my period, but when she had it in, she was just feeling very faint
Okay.
throughout. And so she ended up having to get hers removed because she was like falling out. I don't know what
That
happened. That's her
is-
own vagina and uterus and all that shit. But it just kind of freaked me out.
That I would be scared too.
And then I would also be mad if I was spotting for a while because I've heard that sometimes
Yeah.
people spot for a
You
while. And
can
it's like,
spot for a few
I did
weeks.
this because I don't want to be dealing with this shit
Or
no
you can have
more.
the opposite. I didn't have a period for 6 months.
Now
Nothing
that
came
sounds
out.
like a blessing.
I just feel like you're supposed to have a period.
Why? Let's talk through that. That's a really good point.
Because of how it works, you don't need one if you're on a birth control.
It's the birth control, the hormone that's in it is keeping the lining of your uterus very thin. So thin that there's nothing to bleed or slough off. That's what you're bleeding when you have your period. You're sloughing that lining. So some people have heavier periods because that lining gets so thick, right? So if you have the hormone right there in your uterine cavity, there's nothing to bleed. That's why you're not bleeding. It's not that you're not cleaning yourself out. There's nothing to clean out.
Yeah, there's none of that.
Thank God for the doctors. Last question before we move on to Insights today, because I did want to talk about emergency contraceptives. Can people take this too much? And can you taking
and what is too much?
What is too much? Because I know a lot of girls that just pop them like birth control. Like, you know what I mean? Take another one. Next month. And can they make you depressed?
I want to encourage people to not use them in that manner. I want to encourage you to track your cycle in some kind of way so that you know that when you're actually ovulating, when you're in that window, just popping them for the sake of popping them is not always going to be beneficial. For example, if you're not ovulating the second and you have sex on the first, you didn't ovulate.
You didn't even need to take one.
Exactly.
And Plan B, just getting that
and
money.
then sometimes people get confused because they're like, oh, I took one on the second, so it happened again on the 13th, so I'm not taking it. But you're ovulating on the 14th.
You need to take it because it's still
And then
swimming.
we missed the window. So educate yourself a little bit more about when your cycles are so you can practice more, one, of the rhythm method, pull out, right? But two, do I actually need a Plan B right now? So, Plan B is going to cover you for 72 hours. That's your 3 days. But the Ella is going to cover you for 5.
And what about the weight limits on that?
Oh, I never knew that for the longest of time that there was a weight limit.
So the weight limit is pretty high, and that's for other birth controls as well. So we're talking about like Depo. So those are women that are more than like 350. They normally give it to you in kilograms, but that will be women who are up there in that age range. So you got to.
No, I mean on the emergency one.
Yeah, same.
Because on the package it says something else.
Like what is that?
It says like 100 and some pounds, like 165, 155, something like that.
I'm out of the range.
Look, I was
and
like,
then people,
I can tell you that
not
that's
Ella,
not,
but
that's not true.
It's not.
That's not true.
So it works for everybody the same.
Unless
we talk about morbidly obese, so that range that I talked about up there, more than like 3. Yeah, it works.
Now, can it mess with your hormones in a way where if you're taking it too much, it can cause you to be depressed?
I have not heard that.
You haven't, okay.
And not depressed from the hormones, maybe situational, but not because of the hormones. So what it is the Plan B has levonorgestrel, which is a progesterone. The Ella is a progesterone receptor antagonist, so it blocks it. So it's not an actual hormone. You see what I'm saying? It has a mechanism where it stops the actual hormone from being able to bind. So the only situation where you would be getting this excess hormone will be with the Plan B. And it's so short-lived, you shouldn't really have that side effect.
Mentally.
Now, side effect.
But what if you're taking them every day?
month?
Well, see, taking them often
Because
like
we're
that.
not talking about responsible users.
We're talking about irresponsible users who were busting them like Skittles.
For
Oh,
real.
please don't bust them like Skittles.
They're bust. I was asking that for a specific person, and I hope she listens.
Let's talk about birth control. Let's talk about something that works for you, because we have non-hormonal methods. We have all the things now. So whatever fits your lifestyle, whatever's most conducive, let's do that.
Yeah. Y'all heard it straight from CockTales Dirty Discussions. Dr. Langford is dropping bars. All right. We are going to move on to Indecisive Diane. I mean, no. Are we going to Indecisive Diane?
Well, we ain't really got time for nothing else.
We going Indecisive Diane.
Would you stop thinking about what everyone wants? Stop thinking about what I want, what he wants, what your parents want. What do you want? What do you want?
It's not that simple.
What do you want? What do you want?
Hey, ladies, it's me, Diane. And this week, your date idea happens to be in Mansfield, Texas. I know you're like, why? Who goes there? Well, there's a restaurant in Mansfield off of Matlock Road. It's called The Vault Seafood and Steakhouse. It's bougie for a little country town. So cute. Go there with someone who has a couple extra dollars to spend and dress nice. Bye.
So this one is really short. The subject is, how do you end it? Hey, ladies, I need your
Block his
advice
number.
on how to end it. I'm a 30-year-old man with 2 women that are obsessed with me. On one hand, she's married, but constantly says she wants to be with me and would leave her family life to be with me. If I was selfish, I would absolutely let her, but I think her kids would benefit more with both parents in the house. Even though the pussy is good, I just can't see me breaking up the kids' lives and routine.
You don't want to be no daddy.
And you don't want to pay for the family also. And then there's the other one, an ex that I've been through everything you can think of with. The sex is unbelievable between us, but I can forgive. I can forgive, I just can't forget, especially when I was ready to propose and she left me with no explanation nor reason. Until this day, still never really got an answer. I'm not the best guy by any means, which you do, but I do well for myself of 2 jobs and I own my home. I have plenty of ambition and have goals to go way further in life. I'm honest and tell them both exactly what it is and isn't. I just feel it's time to move forward and start with a clean slate and a new woman, not just be a friend with benefits. Thanks for reading. Signed by your loyal male listener.
Do you have any male friends? Just stop calling them. Stop answering their calls. Y'all do it all the time.
End it, baby. Just end it.
Just say, you know what? I want to try something new. You can say to them what you told us.
Literally. Play the episode for her.
Yeah.
Hope it works out.
And sis, don't go back. Don't call him ever again. Like, he wrote a podcast to break up with you. And y'all don't even go together.
That's crazy.
Yeah, but thank you for listening and writing that in. I appreciate it. Continue to send your emails in to advice@cocktalespod.com.
Whitney, if you want the listeners to contact you, find you, anything you have going on, you can plug it now.
So my professional Instagram is WitnessMD, play on words, WHIT-ness-MD. My personal is very separate, but y'all can follow me on my professional. I'm also going to post my egg freezing journey on there so you all can get some perspective.
I will be watching because I'm 30, about to be 35, so.
I'm 30, about to be 35.
Exactly.
That's some math for your ass. I'm 30, about to be 30 again, so I didn't take many math classes either. Anyways, you guys, thank y'all so much for listening. Thank you so much for coming and sharing your knowledge with us. Please continue to support the show. Make sure you're following us on Instagram. We're at CockTales Podcast. I'm at Kiki Said So.
I'm at Coffee Bean D.
And until next week, you guys, goodbye.
I'm sorry, but the person you called has a voicemail box that has not been set up yet. Goodbye. Bye. 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 Bye.
Population.
Goodbye. Bye. Bye. Wait on the drive. Bye. 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 Goodbye. Bye. 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 Bye.
Population.
Goodbye. Bye. 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 Wait on the track. Wait on the track. I'm sorry, but the person you called has a voicemail box that has not been set up yet. Goodbye. Bye. 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 Bye.
Population.
Goodbye. Bye. Bye. Wait on the drive. Bye. Bye. Bye.